How to inject Omnitrope, presented by Fuze Health. Getting set up. Omnitrope comes in a vial of powder, and it should also have a corresponding vial of bacteriostatic water for mixing. The powder vial is a multi-dose vial, meaning once it's mixed, you can puncture it multiple times because one vial will have enough medication for a few doses. For this injection, you will need 1 vial of Omnitrope powder, 1 vial of bacteriostatic water, a mixing syringe and needle, a subcutaneous injection needle, a few alcohol swabs, a sharps container, and sterile gauze or tissue, optional. Examine your medication. Make sure the medication is not expired. Check to ensure there are no cracks on the vial and there's powder in your powdered vial. Also, make sure the bacteriostatic water is clear and does not contain any particles. If you see anything, call your provider or a Fuze pharmacist for next steps. Preparing your medication. To begin, flip off the caps of the vial of bacteriostatic water and Omnitrope powder and wipe the tops with an alcohol pad. If you have already mixed the Omnitrope from a previous dose, the cap should already be removed, but you will still need to wipe the top with an alcohol pad each time you use it. Unwrap the syringe and injection needle. These 2 items can come attached or it may come unattached. If unattached, attach the needle to the syringe. Once the syringe needle is assembled, remove the needle cap. Fill the syringe with air by pulling back on the plunger. Fill the syringe with roughly the same amount of air as the amount of solution you are instructed to mix with. Place the vial of bacteriostatic water on a flat surface and insert the needle straight through the center of the rubber stopper. Slowly press on the plunger to push the air in the syringe into the vial of diluent. Pushing the air into the vial makes it easier to withdraw the liquid because the vials are pressurized. Without removing the needle, invert the vial and pull back the plunger to withdraw the amount of solution you were instructed to mix with. The amount you draw up may vary by protocol or clinic. Whenever you're pulling liquid out of the vial, make sure the tip of the needle remains submerged in the liquid by slowly backing the needle out of the vial as you withdraw the solution. Flip the vial back and remove the syringe from the vial. You can discard the used vial of diluent into the sharps container. Place the powder vial on a flat surface and insert the needle straight through the center of the rubber stopper. Slowly inject the solution into the powder. A tip here is to aim the stream of solution towards the side of the vial so it trickles down the side of the vial, rather than straight into the Omnitrope powder. This technique can help to prevent foam from forming because Omnitrope powder foams very easily. Gently swirl until the powder is dissolved, but do not shake. Omnitrope powder can take a while to fully dissolve. Remove the syringe and discard it into the sharps container. Place the mixed solution on a flat surface and insert your injection needle straight through the center of the rubber stopper. If your clinic instructed you to inject with a different needle, follow their instructions. Invert the vial and pull back the plunger to withdraw your prescribed dose. Remember to keep the tip of the needle submerged in the solution. This may require you to back the needle out as you're withdrawing the solution. Flip the vial back and remove the syringe. Each vial should have medication for a few doses, so make sure you're not withdrawing the entire content into your injection syringe. Place the unused portion of mixed Omnitrope solution back in the refrigerator until your next dose. To remove any air bubbles, tap on the side of the syringe so the bubbles move to the top. Gently push on the plunger until you see a small droplet come out of the tip of the needle. You are ready for your subcutaneous injection. You should inject at or below the level of the belly button, roughly 1 to 2 inches away from the navel. Try not to inject directly below the navel because that area is very vascular and can lead to bleeding and bruising. You should also rotate your injection sites to decrease discomfort. To prepare for your injection, Clean the injection site with an alcohol pad and allow the area to air dry. Gently grasp a 2-inch fold of skin between your thumb and index finger at the injection site with your non-dominant hand. Hold the syringe in your dominant hand like a dart and insert the entire length of the needle into the pinched skin at a 90-degree angle. You can insert the needle at a 45-degree angle if you have less fat on your body. Move your index finger over to push down on the plunger in a slow and steady motion until all of the medication is injected. When you're done, release the pinched skin. Hold it for a few seconds and gently withdraw the needle. Lastly, apply light pressure to the injection site with gauze or tissue if there is any discharge. Discard the used needle and syringe into the sharps container. There may be minor bleeding, bruising, or redness around the injection site. You might also see a drop of liquid come out of the injection site after you pull the needle out. All of this is common and should not be of any concern. Let's talk about storage. Omnitrope must be stored in the refrigerator at all times. Before mixing, you can leave it in the refrigerator until the expiration date. After mixing, you can store it in the refrigerator for up to 3 weeks. Omnitrope is also light sensitive, so store it either in the original packaging or the amber prescription vial it came in. Great job! You've completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.